Good evening, everyone. This is County Executive Mark Molinaro. It's 5:30 p.m. on Wednesday. You're joining us, if you're joining us now, you're participating in a live telephone town hall. Just have to share this live on my Facebook page as well so that folks can follow along. We're calling households all across Dutchess County, so you'll be joining us on a live telephone town hall. And of course, if you're following and watching us on Facebook, you can follow along. If you have a question tonight and you want to, and you're on the phone call, dial 0. So if you're on the telephone town hall, this is County Executive Mark Molinaro. We're just beginning our live telephone town hall and Facebook town hall. If you have a question tonight and you're on the phone, dial 0. You'll be sent to a queue and asked to record a question, and then we'll get you live to ask your question. If you're watching us on Facebook, and you can do that at Dutchess County Government on the county Facebook page, or you can follow along on my Facebook pages, you can simply comment below, and we'll try to get to your comment or question throughout the evening. So as we call folks, again, we are nearing day 60 since Dutchess County Government has been engaged in response to the COVID-19 coronavirus pandemic that came across the globe and obviously came to America and New York State. And on the phone call tonight, I'm joined by Commissioner Dana Smith, who leads the Department of Emergency Response, and Dr. Anil Wydian, who leads the Department of Behavioral and Community Health, in essence our health department, Dutchess County's health department. So as we call folks tonight, they'll give me a high sign when we get a decent number of people on the call. So this is County Executive Mark Molinaro, and you're joining us for our weekly live town hall event. This is a telephone town hall and a Facebook live town hall. As you get on the line, if you have a question and you're on the phone, dial 0, and they'll send you off to a queue to record your question, and then we'll get you live to ask your question. If you have a question or comment and you're following us on Facebook, feel free simply to comment in the live feed, and we'll add and get you get your question answered. As we populate the call and continue to make calls to Dutchess County residents, I want to sort of give a slow start until we get a good number of folks on the town hall call. But again, this is County Executive Mark Molinaro. You're joined this evening by Commissioner Dana Smith of the Department of Emergency Response, and Commissioner Anil Wydian from the Department of Behavioral and Community Health. So if you're following us on Facebook, we have a few bullet points and slides we want to walk through, but as we do that, and as we're calling, if you have a question, dial 0. You'll be asked to record that question, and then we'll get you live to answer it. We're actually doing 90 minutes tonight. We've been doing 60-minute sessions. Tonight is 90 minutes, and so my friends doing a little bit interpreting are going to be more tired than usual. I'm waiting to see if she laughs at my jokes. No, thank you very much. So with that, I know that this is a serious time for many, and many of you know the impact of coronavirus and COVID-19 very, very personally. As we go through and make these connections and the calls, we welcome you to this live telephone town hall. I want to talk through a couple bullet points and share with you a few slides that you'll see on the screen behind us. First, I want to remind folks about this terminology that everyone from Dr. Fauci and President Trump to Governor Cuomo and local elected officials have been using this phrase, flattening the curve, and this is basically this goal of reducing the transmission of the disease in a way, and by taking the steps we've taken to social distance, physical distance, and stay at home, the goal has been to slow the rate of transmission. So fewer and fewer contract COVID-19, and that we advance the peak, if you will, and ultimately save lives. And what we've referred to as flattening the curve is meant to reflect that we're trying to get fewer and fewer people who contract COVID-19, and then also, of course, try to slow that rate of transmission. And the purpose of this is not to be, punitive, right? This concept of social distancing and closing non-essential businesses, we understand the burden. Believe me, we understand the burden and the devastation that that these decisions will ultimately cause, and we're going to have to work hard to rebound. But again, the goal of flattening that curve and slowing the transmission is not only to save lives, but also to not overwhelm the healthcare system. And it's working in Dutchess County. We have been, we are seeing the results of the work that you're doing as residents in trying to slow that rate of transmission. So as you know, we took steps early on to ban large gatherings. Ulster, Dutchess, and Orange counties worked collaboratively to close schools early. And of course now New York State, and since New York State and the governor have made some significant decisions that have limited non-essential travel, social interaction, etc., all in the goal of slowing the rate of transmission. So since the onset of COVID-19 in New York State, and of course in Dutchess, there's been an effort obviously to test as many people as possible. Let me advise that Dutchess County, through 3 testing sites that have been established in partnership with Nuvance Healthcare, Westchester Medical Center at Mid-Hudson Regional Hospital, and Pulse MD. We have been able to provide testing to 9,200 Dutchess County residents or individuals have been tested in Dutchess County. And what that means, so you know, is that roughly 3.1% of Dutchess County's entire population, slightly above the state number of 2.6%, have been tested. So we've tested 3.1% of Dutchess County residents, 9,200 individuals. And with that testing information, obviously we're able to track to some degree the transmission of the disease. We are working with the city of Poughkeepsie and Governor Cuomo to try to expand testing opportunities for those who might not have access to a vehicle to drive in, and try to make it easier for underserved populations. Mayor Rollison and the city of Poughkeepsie have been partnering with us to achieve that, and we hope that we can expand testing opportunities as more resources become available. But those testing centers, if you will, are certified by the state of New York and the Department of Health, and we need a healthcare provider to provide testing access, and of course the state to authorize them. So let's talk a little bit about some of the concerns that we've had going into this crisis. Right, the concern for hospital beds and access to resources. I'm happy to report, although none of this is happy to report, that we have seen a relatively stable number of cases in our local hospitals. So today, 90 individuals are hospitalized with COVID-19 in Dutchess County hospitals, and that has been relatively stable. So as we see the increase in testing and the increase in confirmed positive cases, we are seeing a stabilization of the hospitalization, and that's important. One, people are not getting as severely sick as they could, and we're minimizing the stress on the hospital and the healthcare system. And this is an opportunity for us to also thank the men and women in healthcare, not only our public health officials who are working every day around the clock for nearly 60 days now, but those who are providing direct healthcare in our hospitals and healthcare settings. Also, as a reminder, we partnered with Dutchess Community College, and we're prepared, if necessary, to open a recovery center for individuals who might not be able to recover at home, and alternatively would end up in a hospital bed. We review that every day with the hospitals. So every day we decide whether or not we need to open that recovery center. As of today, we've not had to do that, but we do have access to nearly 600 beds for individuals to recover from COVID-19 outside of a hospital setting, which would allow us to relieve the hospitals of undue stress if necessary. That's not, thank goodness, had to happen. So you know that we've talked a lot about the steps necessary to protect ourselves. And I want to talk a little bit about what we've encouraged folks to do, and you know them. The most effective way to protect yourself from the transmission of the disease is to simply stay home. Now is not the time for traveling. It's not the time for multiple family members going off to a grocery store, and certainly not the time to have guests at the house. And you know this. So we're encouraging and continue to encourage people to stay home and practice personal hygiene, sort of the basics, washing your hands. You've seen, you know to use the hand sanitizer, and that is very useful. but good old traditional dish soap, hand soap, and water will allow you to simply wash away the disease. So we want you to continue to practice personal hygiene. Wash your hands for at least 20 seconds. Remember, if you're coughing or sneezing, do it into your elbow, not necessarily not out into the air. As we recognize, avoid touching your eyes and your mouth and your nose. And of course, disinfect flat surfaces or surfaces in your home. Now, the one other thing we've encouraged, and we did so last week through a directive by the Department of Behavioral and Community Health, to wear a face covering or mask. Governor Cuomo today announced an executive order requiring individuals beginning this Friday, if you're out in public and you can't practice social distancing, to make sure that you have a mask. And so there's a few things you should know. One, you can access one of these handmade masks. This is actually made by Unshattered, a not-for-profit here in Dutchess County. But you can also simply wear a scarf or bandana to cover your face. And the goal, of course, is to slow the transmission of the disease. And if you're not able to social distance, the mask makes the most sense. If you visit duchessny.gov, later in this week, you'll see sort of a tutorial on how to make a homemade mask. And again, this is useful. It doesn't replace social distancing, but if you have a scenario where you're headed off to the grocery store, or you have to take a bus and you're concerned about others being in and around, simply covering your face and acting as if you have the disease so that you're not transmitting is exceptionally useful. And as we've reminded folks, masks are not a substitution for social distancing. You're on the line with Mark Molinaro. This is our weekly telephone and Facebook Live town hall. If you have a question, simply comment in the Facebook Live stream or dial 0 on your phone. We'll get to questions in just a few moments. I want to go through a few more steps that we've encouraged. As you know, we've encouraged businesses to take steps to protect employees and customers. The face of the first responder has changed in some ways, yes, without question. Fire, rescue, ambulance, paramedics, EMTs, law enforcement, they remain the face of and a critical component of first response. But during this pandemic, the first responder has expanded. And that includes transit workers, folks driving buses and trains. That includes those driving the trucks, transferring and transporting goods and products. It includes the grocery store cashier, or perhaps the hotel clerk who's checking in a hospital care worker or hospital worker. So we encourage businesses to take steps to slow the transmission. Many have. We've issued a handful of best practice ideas that businesses can engage in. You know what they are, and I'd ask you to follow them too. You get to the grocery store, you see that arrow on the ground, and if it says go up and you want to go down, then let's skip to the next aisle. If there's a grocery store clerk, obviously try to social distance, but we're asking businesses to put up plexiglass or a shield to cover that particular worker to protect them. So. We encourage not only businesses but individuals to take those steps. As I mentioned, the state is also encouraging face covering, and that's very, very important. We're also saying to folks that there are certain things that you can do on your own to kind of limit social gathering and encourage social distancing, and those are sort of basic steps you can take, and a few of them are very, very simple. You get to the grocery store or to the Dollar General or to the pharmacy, and you pull into that parking lot. If there's not an empty space to the left and an empty space to the right of you, that probably is not the time to go inside. And if you can wait, come back again when you have that opportunity. The reason, of course, is you don't want to go inside, especially if you have an underlying illness or you're an at-risk or a vulnerable population. You don't want to be inside with dozens upon dozens of people. So you can take those kind of steps yourselves. We encourage you to do that. When you're shopping, shop solo. We're strongly encouraging, and I'd ask you to do this and to be considerate to others. When you go to the grocery store, really only make it one from the household. We understand there's certain families that just can't make that work, but try to limit the number of folks going off to the store with you. If it's maybe not the time to shop as a couple, or certainly not to bring kids if you can leave them at home. obviously with the appropriate child care, but one of their parents. But again, the goal here is to limit that interaction, the gathering, and to slow the transmission. So shopping solo, again, if the parking lot's full, that's not the time to go. Maybe only go out once or twice a week. That's important. When you head out to parks, we want you to enjoy big open spaces and the natural resources we have, and enjoy what will be good weather. But when you're out, keep it small. Avoid crowds and groups. Try not to obviously allow for groups to form. And when you are out, engage in that social distancing. My son Jack has a friend lives right across the street. They haven't been able to play together, but they go out on a bike ride, and they're on either side of the street for the entire ride. Well, if kids can figure this out, we ought to be able to do it too. And that is when you're out, again, keep it small, engage in the social distancing, and if you can, stay local and don't stay very long. And that's just to be considerate of others. We're just encouraging you to take those kind of steps. We're all taught to kind of be considerate to other people. Now's that time. If you want it phrased a different way, don't be a jerk. That's the official order from the County of Dutchess. Now's not the time to push the envelope, but we understand that there's challenges. We know that people are overwhelmed by this, but let's be considerate and respectful of our neighbors, our family members, and our friends, and we know how important that is. So I know that we had a question from Joan from Wappingers Falls. Chris, if we do, let's get Joan on the line. Joan, you had a question regarding, I think, face coverings?
Yes, I do.
Go right ahead.
Okay, I've been in this apartment for over a month. I only go out to get my mail. I got a call from my eye doctor that I have to be there on the 24th, I believe it is, of the 27th of this month. Now, I don't have a mask. I ordered it from Amazon, but, I don't think it'll be here by then. So I'm thinking of cutting up a pillowcase and making one from that.
Well,
and I'll drive there. I'm not taking any public transportation. I'll drive there.
That is acceptable, although I don't want you to destroy your pillowcase. But that is certainly an acceptable face covering. Just keep in mind that you should still engage in that social distancing, even when you get to the doctor. If there's someone else in the waiting area, try to stay distant from that person. But yeah, that's the kind of thing we can do. And I know that it's unusual, and we know that it's a bit of a burden. But yes, that's the kind of thing we all can do. You can take a T-shirt, for instance, and cut it and put it over your face as well. Emily, Melissa, and Jen have all asked on Facebook about public school closures. As you know, Dutchess, Ulster, and Orange acted collectively to close schools relatively quickly. We felt that was a necessary step. The governor and the state of New York have extended school closures statewide till the end of April. I will tell you that while I can't give you a finite date, but I would not expect schools to reopen in any fashion for the month of May. I just don't think that we will be past this time of a regular transmission. We worry that young people will carry the disease back home to vulnerable populations. We also want to be very, candid, right? It's taken teachers, and they're doing great work, but it's taken teachers and school districts several days and weeks to kind of convert to online education. It doesn't make much sense to have flipped that switch and then expect everyone to flip back to a school setting when we know it's just not safe for that to happen. So I'm not going to make any prediction beyond the month of May, but I will tell you that if Dutchess and the Hudson Valley is slightly behind the city of New York in peaking, if you will, in cases, it just does not make sense that we would return to school, allow camps or large gatherings in the month of May. And I think that is likely to happen. You might see some businesses, some essential businesses that might open during the month of May that can practice social distancing, but I think we should be prepared for schools to remain closed through the month of May. I will tell you that Ulster, Dutchess, and Orange have agreed to create, if you will, a work group between the three of us. We'll work together to deal with some of the local concerns so that we act uniformly, so that we don't necessarily have one set of rules in one county and another in another. We'll also inform the state and the governor. We want to be sure that our region is represented in that decision making. We are very tied to New York City for a lot of reasons, but we're distinct from it, and we want to be able to inform the state and the governor and help them make their decisions, so that the region gets sort of represented and our local needs are understood when those decisions are made. So that's what I prepare for. Jerry on Facebook has asked me to explain the difference in numbers between the state and county dashboard. That is a great question that we'll probably be asked every week, if not more often. First, on any given day, like today at 11 o'clock, the governor announces the numbers of individuals who have tested positive. He announces the number of deaths and other data points. He does that at 11 o'clock. That is a statewide collection of information. As you can imagine, it's a big state. Over the course of the next 24 hours, the local health departments, like ours in Dutchess, have to validate and verify that data. And so we have public health officials who have been working tirelessly to verify every one of those cases. And we call them, we reach out to them, we try to trace their contacts, and we get additional detailed information. We do that over the course of a 24-hour period. When that 24-hour period is done, we've been able to validate those numbers, and we update the county dashboard. So our numbers are always 24 hours behind the states, but also more accurate. And that's not a criticism of the state of New York. It's just their numbers are the first sort of swath, if you will, the first draft of that information. And then we're charged by the state to go out and validate that information, which is why you'll see at times a big difference. But that said, when you see our numbers, again, they are always going to be 24 hours behind the states, but they will be more granular and more accurate. Because that's the job of the local health department. So continue to visit DutchessNY.gov. Our data dashboard is very, very useful. You'll see the cases identified by community. We are also working as the state expands its demographic review. We'll include that information when it becomes available. And what that means is, I think, as we go further along and there's broader access to testing, the state will include certain other demographic data points that we'll be able to provide as well. It's just the state isn't doing that yet for counties outside of Westchester, south of us. As they expand that capacity, we'll meet that need as well. I think Carol from Pleasant Valley, and I'm going to prepare Dr. Wythian, this is probably a question more for you. Carol from Pleasant Valley had a question regarding antibody testing. Carol, are you on the line?
Yeah, I'm here.
Okay, you and a few others had a question regarding antibody testing. Do you want to ask that question?
Yeah.
Go ahead.
I'm just wondering how soon you think it'll be before there will be widely available antibody testing for this area so that we can see who's already been exposed to the virus.
Sure.
And who.
Okay, so first, some of that is underway, but Dr. Anil Wythian is the Commissioner of the Department of Behavioral and Community Health. He's an infectious disease. Dr. Anil, do you want to talk a little bit about what the antibody testing is and how that might, when it might roll out locally, and then what's the value of that?
Sure. Thank you, Mark. Antibody testing basically is checking for the presence of something called IgM and IgG. These are two antibodies that are found in the body, and what they indicate for IgM is that someone had a recent infection for a particular pathogen or an ongoing infection. With regard to IgG, it is indicative of a past infection. So this is very valuable for individuals to know whether they were asymptomatically infected or if they became sick, whether they converted and now have antibodies. Now, what we don't know is whether these antibodies indicate whether someone is protected and will not get the disease or is spared from future illness. But it's very helpful to guide us in terms of knowing the level of infection in the community, the level of asymptomatic infection that has occurred, and whether we're at a point where we could safely return to the new normal.
And I apologize. And when might we see that more available in the Hudson Valley?
Got it. The two ways you could do antibody testing is through drawing blood or serological testing. A lot of the academic centers can do that, but it's very inconvenient for people to go and get that done. There is something also called point of care testing, where it's a kit and the results can be available within 20 minutes. I will tell you the FDA has approved numerous products through an emergency use authorization. None are FDA approved, but they all fall under the issue of production and the ability to produce mass quantities of these testing kits, and we're not there yet. We're hopefully within a week or two out from that point.
Okay. And so we get questions often, Anil, about when would we see a vaccine for this disease, and what's the response to that question?
I will tell you that there are numerous pharmaceutical companies that are, working around the clock looking at this. And some figures that have been quoted include 12 to 18 months. And that's a conservative figure because, there have been instances in the past where they've accelerated and brought a vaccine to market only to find out that it does more harm than good. So it has to be done in a stepwise fashion where, number one, they find out that's effective. Number two, they do human trials to find out that it's safe, and then larger trials, and those larger trials validate those initial findings, and then it's rolled out to the general population.
Thank you.
So we're talking about at least another 9 months to a year minimum.
Okay. Thanks for that. I appreciate that, Anil. We are getting a number of questions regarding mandates and accessing of masks. The first, I want to use this as an opportunity. If Joan is still on the line, I know she's not on the call, but if she's still listening, Joan, who's headed off to the eye doctor and was going to use a pillowcase, I do want to say that you've got great Dutchess County neighbors. Stephanie and Lori had just commented on Facebook that they want to make you a mask, Joan. So the only reason I say that, and now, if Joan wants, I'd be happy to share that information with Stephanie and Lori, and we'll get you your own mask. The reason I think it's good to point that out is, and we didn't talk too much about it. Listen, we are living in what is an unprecedented time, but what will never cease to amaze me is the generosity of Dutchess County residents, and you saw it just there. We see it all the time. Countless volunteers stepping forward to help. We're running a program, our initiative, Dutchess Responds, is really a coordinated effort to try to provide assistance to families, individuals who need help. And if you have a concern, you need access to food, you need perhaps access to some support, or you need additional questions answered, you can visit dutchessny.gov, or visit Dutchess Responds, or dial our hotline. So the coronavirus hotline is open and available if we're not staffing it at the moment, although it's staffed quite a bit. There's an automated system, but you dial 845-486-3555, 845-486-3555. And if you press 2, you get information. If you press 5, there's food. If you press 6, it's for transportation, and 7 to volunteer. I just offer that. This is our effort to try to connect people who have need with people who want to volunteer, and we've seen so many people step up. So let's go to a question from, I think Layla has a question regarding accessing masks and grocery store. No, there's a lot of people who have that question. We're not going to go to Layla. I'm just reading what you said. So we have a lot of questions. I apologize. We have a lot of questions of folks who are asking about accessing masks and products. So we had Christina ask about, is there a county mandate regarding grocery stores? I'll get to that in a moment. Jen asked, are grocery store workers mandated to wear masks? Dana Smith is on the line. Commissioner Dana Smith, I'm going to ask you to give us a little bit of direction on what we've been doing in the county to access personal protection equipment. But before I do that, number one, essential workers, employers of essential workers are required to provide face coverings or allow and enable their employees to use face coverings for their work. So, Layla is on the phone, and she's a grocery store worker, and she wanted to ask a little bit about that. So why don't we go to Layla?
Hello?
Yeah, go ahead. Why don't you make your comment or ask your question, and then we'll answer a whole series of questions about accessing masks. Go ahead.
Yeah, I work in the bakery,
Yeah.
and we do wear masks and gloves. and you see people come in for little stuff that aren't like essential needs, that I feel aren't such essential needs, like little things.
Yeah.
But is that good to let people in like that? And I also wanted to know, should essential workers everywhere be tested even if they're not showing signs, because you don't know who is bringing in what
That's
as customers?
those are two good questions. So let's start with the essential. If you're deemed an essential business, and food services, restaurant service, bakeries can remain open. Again, the preference is curbside. We are strongly encouraging businesses to engage in some curbside pickup, so that customers don't have to come inside and you don't have to have that interaction. But that is still deemed appropriate, and what people buy at the grocery store or buy at the bakery is up to them, but the business is deemed essential. You are correct that essential workers should be wearing a face covering. So it's good that you're able to do that at the store you're working at the bakery that you're at. But employers of essential employees or employers of essential businesses are to provide that to their employees, or give them the opportunity for that. So let's do this. Dana Smith, why don't you talk a little bit about accessing and purchasing this kind of material, and what we've been doing both countywide for those frontline staff, and then what we recommend for essential staff. And then Anil, I'm going to jump to you and just ask you to answer the question about, is it appropriate to test someone if they haven't, if there's no indication they have the disease. So let's start with Dana. Why don't we talk a little bit about purchasing masks and what the county's been doing, and just know that we're all trying our best to make sure that folks have access to those resources. Go ahead, Dana.
Yes, sir. Good evening, everyone. The Department of Emergency Response in the county's primary focus with PPE has been to direct care providers in the hospitals, emergency services, assisted and family living settings where there's developmentally disabled patients, in the nursing homes and medical facilities who treat patients with COVID, and that's our primary responsibility for them. And county workforce that has a responsibility to deal with COVID patients. We are sharing information, and I know we'll have more out tomorrow with the business community on resources that are available in the community for businesses that can go and get different face coverings. There's information on the CDC's website. I also believe on the county website. And Neighbors Helping Neighbors, you already brought it up on the Facebook post. People are willing to help each other and make it masks. So the order, my understanding is it calls for a face covering. The equipment that we're supplying is primarily designed for individuals who are treating COVID patients in a medical setting or in a housing type facility. And it is extremely challenging. We can understand the frustrations. I personally in our department has been living it for about 4 weeks to 5 weeks now, and we're turning over every stone to find more and more PPE for those who provide care in our community.
We appreciate that, Dana, and let me offer, there are a number of businesses locally that are making the product, are making coverings that businesses could purchase. So again, number one, essential businesses need to provide that, at least avail employees, to make use of face coverings, and they can do that, again, their own homemade or a scarf or bandana. And of course, if possible, they can make a purchase of that equipment, that material, and we're providing them information to facilitate those purchases. Before we jump to Anil, I want you to answer that question about when it's appropriate to be tested, and whether or not one should be tested ahead of seeing symptoms. And I understand why people would be concerned. There was a question from Christina about whether or not the county mandates a limit to the number of customers in a grocery store or pharmacy. First, you should know that Governor Cuomo, in issuing his orders several weeks ago, did assume responsibility for those local orders. So the ones that Dutchess County issued initially, and that includes school closures, those remain Dutchess County orders. Some of the more specific ones you've seen of late are really now the responsibility of the state of New York. There is no limitation on the number of, there's not a mandate to limit the number of people, but we're saying you should limit it. So if you get to the grocery store and it's full, don't go. And I ask residents to be very considerate. Again, don't be a jerk. if you get there and it's a crowded space, it's not the time to go. And I know how difficult it is to rearrange. We have 4 kids ourselves, and trying to rework schedules is very difficult at times. That said, to the extent you can, try to engage in that social distancing. If there's a car to the left and a car to the right, that's not the time to park. If you're going to the pharmacy and there's 4 or 5 people that are there, it looks like they're getting ready to wait in line to get their prescription, that's maybe not the time to step inside. So those are the kinds of things we need to do. Again, we are sort of mandating the social distancing, so if you can't engage in it, then you shouldn't be there at that moment. And those are the kinds of things that we really need folks to continue to do. And again, the reason we're doing this, and we're asking you to do this, is not to be punitive, it's not to be so utterly restrictive, it's to slow the transmission of this disease, to allow the healthcare system to deal with it, and for us to minimize the number of lives impacted and the lives lost. And I understand, believe me, I follow social media, I hear what people have to say, they're getting very uncomfortable with the government telling them what to do, and I get that, I understand that. This is we're now in really only 32, 33 days, although public health officials have been at this for the last 60 nonstop, and employees all throughout local governments have been responding across the country for about 60 days, but we're in about 30 days, and the devastation is going to be real, and the challenges are going to be real on businesses and employers and families. But we need you to hold firm just a little bit longer in order to slow the transmission, and we're actually making significant progress. If you look at Dutchess County's numbers, we're doing well, and we don't want people to be infected, we don't want people to get sick, and I can say firsthand, we don't want people to die because of this disease. So continue to hold firm, continue to make those smart and considerate decisions, and I promise you, we'll get through this. We'll get through this together. Anil, that question about is it appropriate to be tested if you don't have symptoms, or if you just think you might be sick? What direction and what comfort can you give individuals so that they're aware of what they should or should not be doing?
That's a great question, Mark. I think people have to understand when a physician orders a test, it's because they are suspecting a particular disease state or an infectious process. So it's important that they have a reasonable suspicion that there is a process or an illness. And so when they order a test, if the likelihood is extremely low, the value of the results of that test is also quite low. Now, if the suspicion of that disease or infection is extremely high, then why bother even doing the test? So the test is useful when a person is trying to use the results to make a diagnosis, plan for treatment, or prognosticate. If it's not doing that, then the value of that test goes down. So doing a test on an asymptomatic person, the results of that test yields very conflicting and potentially false positive results. So the advice right now is if you have questions, have a discussion with your doctor. They could steer you in the proper course to go, whether testing is appropriate or not.
Thank you for that. I think we had a question from Tracy in Hyde Park on the phone. She was asking about basically what do you do if you're uninsured. Tracy, do you want to ask that question? Are you there, Tracy? We may have lost Tracy. Are you there?
Hello?
Oh, go ahead, Tracy. You had a question regarding, I think regarding what to do if you're uninsured, and we have had a few of those questions. So go ahead.
Yeah, I mean, I don't have where I work. I can't afford the insurance. I actually take care of an elderly person who's 88, and I've just been more, worried about her. So I haven't been looking for the insurance. But what do I do if I think I have the virus? Who do I call, or what do I do? That's
a really important question, and what we obviously recognize in this country is that the disparity between those who have access to health insurance and those who don't. Now that's a bigger conversation. But Anil, while we have you on the line, what's the direction, whether insured or uninsured, to accessing a test?
So currently, you mentioned that there are 3 sites where testing occurs. If someone is concerned and they're worried about access to a physician, the health department has facilitated those individuals in writing scripts. But there's also the ability to go to PulseMD, where they probably can accommodate you. I'm not sure whether the federally qualified health centers are doing testing at this point. But again, if there is an absolute need, reaching out to the health department, we'll try to find some mechanism of ensuring testing.
So if you are insured, the step to, either way, the step to get tested is first to contact a physician. And again, we're encouraging people to remind you, if you feel like you've contracted COVID-19 or you have symptoms, you're not, unless it's severe or unless you're in distress, we don't want you running off to the doctor's office or to the emergency, or to the hospital. If it's an emergency, dial 911. But make a call to a physician first. If you have a physician, make that call. They'll evaluate and they can write you a prescription for the test. If you have a question, if you don't have a physician, you don't have insurance, you can reach out through through our hotline 845-486-3555, and we can we can get some information from you. And as Dr. Wiley has said, if you don't have insurance, we can facilitate getting you a prescription for a test if you meet those basic protocols, right? When's the right time to get the test? Or you can, and we'll give you the contacts, you can reach directly out to to PulseMD is one of the testing sites that can accommodate those without insurance coverage. So we'll try to make those connections, and I can tell you, having seen now 9,000 tests administered, there are many people without health insurance who are being tested because it's appropriate to do so, and we're facilitating that to happen. So thank you for that question. Thank you, Anil, for that answer. I'm going to jump back to you, Dr. V, with a question from Christine. I'll give you a second to think about it. She wants to know if we're still tracking and informing patients and contacts of individuals who've contracted COVID-19. But before we do that, Teresa on Facebook had a question regarding respite for single parents of children with special needs. I think you all know, first of all, single parents at home are doing an amazing amount of work with kids home. You may be an essential worker, you're trying to balance getting off to work, or you are home with your children, regardless of ability. There's always a need for respite. And what I would offer to you is that for those who are living with individuals with intellectual and developmental disabilities, if you visit thinkdifferently.net, or reach out to our hotline at 845-486-3555, we can connect you with service providers. And to the extent they're available, or we can access the support, there are a number of not-for-profits and service providers here in Dutchess County that are available to be of some assistance, and providing respite or assistance to families is critically important, in particular for those living with intellectual and developmental disabilities. I'm the parent of a child with a disability. You know how important this Think Differently initiative is here. Hundreds of communities across America have embraced Think Differently as a call to action. So our goal is to make sure that you have the support that you need. And again, if you visit thinkdifferently.net or dial and call our hotline at 845-486-3555, we'll try to make that connection. Anil, to Christine's question, is the county still tracking and informing contacts of COVID-19? Now, this is a really good question, because when you start with one or two cases, identifying those individuals and tracking and contacting all the potential contacts is relatively easy. That protocol changes over time as more people get tested and we recognize more and more have contracted it. But go ahead, Anil, what are the protocols?
Mark, you're absolutely right. When we had dozens of cases, our DVCH staff was able to do a very thorough contact tracing and follow-up and monitoring system. But now we've eclipsed over 1,600 confirmed cases. So we've had to sort of prioritize and stratify people according to risk. And so we started off with a few staff reaching out. Now we have 4 teams, and these teams are volunteers, these are MRC members, these are people with some guidance that we've done training for. We will expand to another 2 teams to have a total of 6 teams that will reach out all the confirmed cases, look at immediate family members, look at contacts that have high risk disease states, such as cardiac disease or pulmonary disease. And then, yes, we do contact tracing. We make sure that people are on home isolation and are under quarantine. And ultimately, when the confinement period is over, we clear them to go back to their normal activities.
Thank you for that. So someone who tests positive for COVID-19 has to be quarantined for how long? Anil, I apologize.
Currently,
Yeah, if you're,
yes,
yeah,
currently, if they're a contact, the guidance is 14 days. Because again, individuals may take up to that period of time to develop symptoms. If indeed they become a case and are symptomatic, the current state guidance states that they could remain on home isolation until 7 days have lapsed from the onset of symptoms and 3 days have lapsed from the person being totally free of fevers and a significant improvement in their symptoms.
Okay.
So actually the confinement period can be quite long depending on where you start with.
Okay, fair enough. So if you test positive, you're basically 14 days quarantine. If you're a contact, you're basically 14 days quarantine, and that could shift depending on whether or not you show symptoms.
Yes.
Okay. We appreciate that. So if you're on the telephone call now, this is County Executive Mark Molinaro. This is our weekly live event. I want to let you know that if you are interested, you can join us next Wednesday, April 22nd. We'll announce the time early next week. We'll have a live Facebook town hall on April 22nd with the time to be determined. The following Wednesday, April the 29th, we'll be holding again another Facebook Live and telephone town hall at 5:30 p.m. So we're here tonight until 7 p.m. If you're on the line and have a question, dial 0. You'll be asked to record your question, and then we'll get you on live to ask that question. If you're following us on Facebook, simply comment below and below the live stream, and we'll try to get to your question as we go on till about 7 o'clock tonight. So let me also offer to you that we know that this is a very stressful time for so many. Dutchess County is fortunate to have a very comprehensive mental health program here in the county. We have more resources than most counties across the country. We are still operating those 24-hour, 7-day-a-week services. If you have a particular need as it relates to drug addiction or severe mental health concerns, our stabilization center is functioning through telemedicine. And if you are simply in need of some mental wellness assistance or mental health assistance, you can always call or text Dutchess County's helpline. Dutchess County's helpline is 845-485-9700. You can call or text that number, and we have trained professionals available 24 hours a day, 7 days a week. I can tell you that I've had individuals who reach out to me, and I immediately contact or connect them with the helpline. So it's a resource that's available to you. We're here to be helpful. We want to be helpful. If you have a general question regarding access to food or transportation or questions regarding the county's response or some specific concerns to coronavirus and COVID-19, you can reach out to us at our hotline at 845-486-3555, and of course visit dutchessny.gov for regular updated information. I do want to tell you, county government is still operational, albeit in a sort of a skeleton of itself. We have many hardworking and dedicated county employees who are working from home, providing essential services. We have certainly a percentage of our employees who are responding still at work, coming to offices and working because they provide that essential service. When we began this response to the pandemic, we initiated basically a sort of a steering work group, if you will. So a team of people that every day we meet every morning via teleconference. We go through the status report for that day. So situationally, we get some awareness. We talk about the challenges from the day before, some of the unmet needs, some of the problems that need solutions, and then we work through that through a work group structure. It looks very much like you might envision sort of a military operation with different work groups working on different areas of both government response and responsibilities, community concerns, economic concerns, and our direct public health response to COVID-19. Those work groups are constantly working. We've made use of technology, as you have. Microsoft must be very happy with us. We've used Teams and others, other tools to make sure we're having that contact. But we have a dedicated group of people who are providing key services, and you can find that contact information so that you know how to reach out to us at duchessny.gov or by calling the hotline. We'll make sure we connect you with those essential services still being provided by county government. And we're very, very grateful to the team of people who are working every day, and we do. We work every day, all day, responding to your concerns and making sure that we're responding to this pandemic. So all of that very, very valuable and important. If you have a question, dial 0. Then we're going to go to Ken from East Fishkill. Ken in East Fishkill had a question that we know is on the minds of many folks who are unfortunately are out of work, and that's a question regarding unemployment. Ken, are you there?
Yes, hello.
Yeah, go ahead.
Yes, I'm here.
Go ahead, ask your
Yes,
question.
hi. How
Yeah.
are you?
I'm
Hi,
doing.
Mark. Yeah. I applied. It's easy to apply online, but they tell you that you have to wait within 72 hours for someone to call you to finish the application, but it's been longer than 72 hours. So I'm not sure, and I am sure that the system is overwhelmed, and it's not really a county issue, but I'm not sure if you've heard anything or if you've been in contact with the governor, if you know if there's any way that they are beefing up the staff to take care of all of us. I mean, I was furloughed, hopefully I'm going back, but still in need of those unemployment benefits would be very, very helpful.
It's a great question. A number of people have it. So first, we commend the state of New York for moving aggressively to expand access and unemployment coverage. This is unprecedented. In fact, we probably, and I offer this, we have not seen this kind of economic impact since the Great Depression. Even in the immediate aftermath of 9/11, which was devastating and a horrible and tragic crime committed against this country. But this prolonged unemployment and closure, if you will, of whole sections of our economy, we've not seen anything like this since the Great Depression. And for some people and for some businesses, it's going to feel like the Great Depression, meaning that the new normal may make it so difficult to compete again, we may have businesses that don't open. So I'm hopeful that everyone sitting at home will have a job to go back to, but we recognize that challenge. So the state of New York did create a resource to get access to unemployment insurance, but as the governor admitted a week ago, they weren't prepared for the magnitude of requests. Now, again, I think you could imagine the numbers are staggering. Dutchess County created our business notification network. This is in conjunction with the Chamber of Commerce. We communicate with 8,000 small businesses and employers all across Dutchess County every day. The very first thing we said to the state of New York was eliminate that follow-up phone call. Allow people to apply through an online system, accepting that some of that can be manipulated because you're not talking to a person, but allow that unemployment system to function entirely online and only make the connection via phone if somebody doesn't have access to the internet. They chose not to do that. We still think that makes sense, but they did expand the number of people taking calls to the numbers of thousands. So they are trying to catch up. The good news is, no matter when you finally make that connection, you are eligible for unemployment from the date of severance. So whether furloughed or laid off or unemployed, laid off or furloughed, you'll have rights to those benefits from that day forward. And the governor, recognizing that the system is delayed and overwhelmed, the state is adding dollars to the benefit. So to your question, we've heard countless people say they haven't heard back. Some have gotten the call back within 72 hours or a few days. Others are still waiting, but we do expect that you'll get that call. And if you'd like to learn more if you're an employer and want to know more about those tools and resources, visit duchessbnn.com, Duchess Business Notification, bnn.com. And if you're still out there trying to access resources, you can always reach back to us and we'll try to make the connection as best we can. Assistant County Executive Ron Hicks for Economic Development, this is basically his day, all day, every day for the last 60 days. responding to and advocating on behalf of the businesses and employers, trying to get the state and federal system to pay attention to employees like you can, and trying to make those connections. And we're going to continue to advocate for you because we know that this is just terribly devastating. On Facebook, we had a question regarding, is Metro North still running? Are they running a normal schedule? And then Diana asked a question about, will we be able to vote in person? Number one, Metro North is still running, but not on a regular schedule. So you should check Metro North's online schedule. It's been altered, and rightfully so. We need to be able to limit that transportation and the numbers of people grouping together. No question, subways and transit systems are places where transmission of the disease can run wild, and there have been alterations to the Metro North schedule. You should go online to look for that, and if you have any questions, certainly reach back to us. Diana asked about voting in person. First, the governor and we agree, if you happen to be registered to a political party, and you want to vote in the presidential primary has been moved to June. Now, at this point, there's no contest in either party for the presidential primary, so it's possible that could maybe not have to happen. But if it does happen, you can vote absentee. You can vote by paper. They're not eliminating yet the need to show up. The availability to show up in person, but we are encouraging people to take advantage of the absentee ballot. The system here in New York is very tightly run, at least in the counties. I mean, there's some problems in how they do it in New York City, I recognize that, but I can tell you that my experience with the absentee ballots and the way in which they work here in Dutchess County, we've got a professional staff at the Board of Elections. They validate and verify registration votes. Just as a reference, we moved. My wife forgot to change her registration or not forgot, we just didn't get to it. And she, in fact, had to vote through an affidavit ballot for me for re-election. That's how strict they are when it comes to making sure that those paper ballots meet up with or connect with the voter. So you can do that. Not yet. There still will be the ability to vote in person, although the goal will be to ask more people to vote absentee, in particular for that presidential primary in June. And if we still have restrictions in November, which I would venture to guess there will be some limitations, but certainly not as strict as they are today, we'll, I'm sure, see an expansion of access to absentee ballots. Kathy in Statsburg, employer required to quarantine will be returning to work. What if he or she gets exposed again? Do you want to ask that question, Kathy? Feel free. Kathy from Statsburg.
Hey, Mark, how are you?
I'm
yes,
great.
I would like to ask that question again.
Go ahead.
Because I'm fine, and we were quarantined. I was exposed to a coworker who ended up in the hospital.
Yes.
And unfortunately, my job got changed from a non-essential employee to an essential employee, packing out for the ShopRites, their groceries and their dairy. So we were told to stay home and quarantine ourselves for 2 weeks, and now we're wondering, or I'm wondering, what happens when they send me back out on Tuesday and I get exposed again?
Well, the short answer to the question, practically, not medically, is that you should be going back to work to a setting where people are socially distancing and wearing face coverings. And so if you're going back to the grocery store, you're going back to an essential job, remember, you first can show up with a mask or a face covering, or your employer needs to make that available to you. From a medical perspective, Anil, do you want to answer that a little bit? Just what is so if she tests positive, you've gone through the quarantine. What's the likelihood of being recontracting the disease, and what does that look like?
Okay. Let me make sure that I have the facts correct. You were placed on isolation but never became positive?
We've actually, she's been moved back to listening, so why don't you answer both of those questions? Let's assume for a moment she tested positive, she's been quarantined for 14 days, she's now returning to work. What's the risk of getting reinfected? And then if she was just quarantined without testing positive, well then she still runs the risk, obviously, of contracting it if she comes into contact with somebody who has, right? That's an easy one. I can answer that one.
That is easy. So again, if she never converted, and we don't have any serological evidence that she turned positive, if there is an exposure again, we would have to go through that quarantine process again.
Okay.
But you mentioned that, again, if she's put in a situation of going back to work, you have the advantage of knowing the situation and also having personal protective equipment on, so that we wouldn't consider that as a high-level exposure.
Great. So let's say for a moment that somebody has tested positive, they've gone through that quarantine, and now they're returning to work. What's the what concern do they have? I mean, you know, the folks have said, well, if I've already contracted it, it's not likely I can get it again. What's your advice?
There is not a body of evidence out there in the medical literature as to whether someone can get this multiple times, whether being exposed and developing antibodies is protective. So unfortunately, I cannot give you a firm answer with regard to that question.
So positive or not, we should all function as if we have the disease, shouldn't we? We should wear the face coverings. We should
absolutely, and protect ourselves and others.
Yeah, and do it as an act of selflessness, and without you know, getting too deep into it. Believe me when I tell you personally how valuable taking those steps can be. As an act of selflessness, do the things necessary just to protect yourself and your neighbor. Pat was on Facebook, had a question regarding town courts open for traffic violation, court dates come and go on. Well, first, I would make sure that you've communicated with your local court, and if you've attempted to communicate via phone and left message, whether or not you need to appear. First, local courts aren't functioning. They've consolidated and they're doing courts via telephone. However, you know, they're sort of triaging. They're based on, you know, they're deciding based on the crime when you finally get around to doing this via telephone. So local courts are closed. You could be contacted by the prosecutor to let you know what the time schedule is. But I would just make sure you've taken every step to notify the local court that you're aware of that ticket or that appearance date. It's come and gone, and you're just waiting for direction. If there's a truly significant concern, you will be contacted by the attorney for the municipality who prosecutes, or the district attorney if it's a case that requires that, or the court itself saying that you need to appear via telephone. I would say to you, not that we want folks to flaunt this, but if it's a traffic violation and a single issue, you're likely not to be in the next batch of people that pose a priority for the court system at the moment. You should not be penalized, and I just would keep at least some record that you've emailed or communicated with the local court. If you're on the call, you have a question, dial 0. We'll take your question, get you into the queue, dial 0 for that. We did have a question regarding an individual. Chris, is that still there? No? Okay. But there was a question from an individual who said their daughter was living in New York City, returned home here to Dutchess with their family. What should they do as far as quarantine? You know, our guidance is that if you're coming from a hotspot, the epicenter, if you will, of COVID-19 cases, and you're returning home to your parents' house, we would advise to quarantine for 14 days. That self-quarantine, self-isolation, self-sequestering is appropriate. You'll limit the possibility that you will transmit the disease, and we encourage you to do that. We also say to folks, listen, now's not the time to travel south unless you have to. If you don't have to go to Westchester, you don't have to go to New York City or Long Island, believe me, my colleagues in those counties will not be offended that you chose to stay home. I speak to the county executives on Long Island quite often. I will tell you that they are responding effectively, but they recognize, as do we all, that we're at a point now where if we just hunker it down, we just stay home, we can slow the transmission. We can obviously not contract the disease ourselves or cause others to contract the disease. And now is not the time to travel, and I think we all can understand that. So if you've traveled into the city and you've been working there, or you had as a kid a college student there, or you were spending time in an apartment there, and you come home to your parents' house, you should stay home for 14 days quarantine. I'd say for your parents, you might want to quarantine away from them as well, but nevertheless, that's the guidance that we would offer. If you have a question, dial 0 on your phone. If you want more information about what information that could be helpful to you, visit dutchessny.gov. dutchessny.gov. You can also reach out to the hotline at 845-486-3555, 486-3555. Got it? Good. We're going to go to James. James from Beacon had a question regarding schools. James, go right ahead.
Hello.
Hello.
I have a question to you. I'm a custodial worker in one of our school systems here in Dutchess County.
Yeah.
If schools are closed, should everybody be staying home, or should that be up to the school district on who goes into the buildings?
It's a great, good question. So first of all,
because I'm an older gentleman, I'm like 61. I'm going to be 62 in October.
Well, thank you for that. That's not old at all, believe me.
Well, you know what I mean.
I agree with you. So this is what we say to folks. First of all, certain job functions, even in a closed business like schools, are deemed essential. That doesn't, however, mean that the school district or the employer needs you to come in. And what we've said within certainly public employers, and the county is a public employer, you're not all essential all the time. And so the goal is always to limit the number of people reporting to work. And I know that may conflict with some of the guidance that some employers have been given. So what that means is, frankly, you don't need people getting off to the building all the time, every day. So if there's a way of limiting the number of people who are coming in to do some maintenance work, this is not the time to come up with some excuse for busy work. This isn't necessarily the time to encourage people to just show up to sort of not have anything to do. So number one, if there's an essential task, they could ask you to come in to do that. That is legitimate for building maintenance and property maintenance. Those are essential responsibilities. I would say, as the county executive, I ask employers to not push that. If there is not essential work, then allow that individual to stay home, because there are other individuals who are not providing essential responsibilities that are staying home, and the goal here is to limit the transmission. If you are coming to work, James, I think it was James, and you are, first of all, if you are deemed essential, you have right to wear face covering. Your employer has a responsibility to make that available to you. And I would say to employers, just as we've done, if there are vulnerable populations, individuals that might pose a higher risk should they contract the disease, if they're not necessary to come in at any particular time, then don't make them do that. Have them come in when it's necessary. Have them provide that service when it is necessary. I don't like the term essential versus non-essential, because a job is essential to everybody. We like to say, is it necessary or not at any point in time? If that task is not necessary at this point in time, then let's not force somebody to come in. If it's necessary at that time, then they should do it. Norma had a question or comment encouraging those not living on the edge to donate. I think that's a nice way of putting it. Dutchess Responds is our coordinated effort to provide assistance, food, transportation, and aid. I will offer to you that we've had hundreds of volunteers come forward, and we're serving thousands of meals across Dutchess to seniors in partnership with Community Action, the Community Action Partnership, Dutchess Outreach, Mental Health America, Hudson River Housing, and others. We're providing assistance, food, and other assistance to those who are homeless, to those who are, as Norma says, living on the edge, and to those who are isolated. We're providing that assistance. We need more help to do it. So if you do have resources available, if you happen to have a few dollars you wish to donate, thanks to the community foundations of the Hudson Valley, we have so far, I think, collected nearly $300,000. We have a goal of $500,000. Grateful to residents at Silo Ridge in Amenia have helped us raise almost half of that. We're very grateful for that. What I would say to you is, if you have some resources to donate, please feel free to do that. Those dollars go directly to buy products, foods, assistance to individuals who are in need. Sue had a question. We're going to go to Sue, who had just a comment. I think it's a good comment, and I want you to say it. What do you want people to be?
Be nicer.
I think that's be nice.
I work as a cash register at a supermarket, and people are being meaner and meaner. And I didn't bring this on.
Yeah. No, but you're also, by the way, all of a sudden a frontline responder in a public health crisis facing the entire globe. So the responsibility is pretty heavy on you and folks like you, and I'm grateful for that. I think that's a great a great comment, and we said this before. Don't be a jerk if you're out there, but more importantly, be considerate. I'd offer. We recognize that this is unprecedented. The challenges and the stress on everyone is pretty high. Know that the men and women who are going off to work, maybe they're cleaning, maybe they're cleaning the dorms at the community college, or maybe they're a cashier at a grocery store, or they're going off to provide some essential work. When they know that their health is at risk, be considerate of them. Listen, it goes a long way just to be kind. In fact, every time I give a message, every day we do a live or a recorded message to kind of encourage people and to answer some questions. We say, stay safe, be healthy, and be kind to each other. And I mean it. And so I'm going to take this moment to tell you what I shared with you last week, and many of you know. I've been blessed to have two men in my life, two dads in my life, my biological father and my stepdad. My stepdad's doing pretty well with living with my mom. My father, who lived in Westchester County with my stepmom and my sisters, who live on their own. But as you know, 2 weeks ago, my father, Anthony Molinaro, went into the hospital having contracted COVID-19, coronavirus. It came on him very quickly. He experienced very severe symptoms. He was immediately put on a ventilator at Westchester Medical Center, near where he lived. The caregivers there were just tremendous, and the work that they do to not only care for the patient, but to be that conduit, sharing our concerns, answering our questions, and communicating with the patient. It was just remarkable. My dad didn't win that fight and lost his battle last Friday afternoon. What I can tell you is that all of us, we pray for just a few more minutes with the people we love. I was fortunate. I got 5 more minutes on the phone. He listened to me, right? He was intubated and couldn't communicate. I got 5 more minutes. There are countless families who are struggling right now, just praying they get 5 more minutes. 5 more minutes at work, 5 more minutes with a loved one, 5 more minutes to say goodbye. This is not the time to be rude for no reason. This is a time to summon within us the compassion and decency that I know exists in every human. This is that time. And so I really will encourage you to be patient, to respect the fact that a lot of people are struggling hard. That goes both ways. That your feelings are valid, but to the extent we can express that kindness and respect to one another, that I think will go a long way. And I promise you that those five more minutes for anyone, 5 more minutes of calm, 5 more minutes of peace, 5 more minutes of hope is a big deal, and it means something. So thanks for that comment. You said it probably more authentically than I could, but don't be rude. We're going to go to Steve, who's on the line. If you have a question, dial 0. Steve's on the line. Had a question about when will Dutchess allow people to go back to work. First, it's not a Dutchess County order, but go ahead, Steve, ask your question. I'd be happy to answer it.
Yeah, when will the people who are out of work be expected to be back in work?
You mean any job, or for Dutchess County government? You mean just as any work?
Any job.
Yeah.
Any job.
Well, yeah. The short answer is there is no immediate answer, and that is, as the governor said, first of all, these are state orders that have deemed businesses essential or not essential. Those that are deemed not essential, of course, you're at home, hoping certainly that you have a job to go back to. And please believe me, I know. I was on a call with several hundred business owners this morning who are all so concerned. The short answer is that it took us weeks to get here, and we've slowed the transmission, but we can't turn the valve on immediately. You can't just get everybody to go back to work, because what will happen is the disease will immediately begin to take hold again. We will get more people sick, and they will overwhelm the hospital system, the healthcare system, and sadly become sick and lose and die. And that's not something that we can see happen. So you're going to see a slow transition back to a new normal. That new normal is not going to look like what normal was prior to March of this year, but it's going to be incremental. And so I would offer you that businesses that have employees that can maintain social distancing, that can stay somewhat distant and not have groups, those kind of businesses will likely open first. and over the course of time, there'll be a transition back to everyone getting back to work. But I suspect that is several months, not several days or several weeks. That sometime in the month of May, I think you'll start to see some businesses, perhaps like landscapers, for instance, might start going back to work earlier because they can limit the number of people out. Maybe you'll see some of those kind of activities, home repair, house painting, those kinds of things. But you're not going to see every retail store open. We're not going to see restaurants open up as they did until several weeks and months from now. And you're going to see that slow transition over the course of the next several months. And we're going to be here with you. But the challenge is going to be real for a lot of people. But I would expect not to see much opening of the gates, if you will, until sometime in May. Likely in June, you'll see another sort of transition, and we will work with the state to inform them and help move that as quickly as is possible. Dr. V, while you're on the call, on the line, we've got 15 more minutes before we have to close up tonight. If you have a question, dial 0. Why don't you give the doctor's version of what I just said? Why wouldn't we just get everyone back to work? I mean, right now, and by the way, there are some who say let everyone go back to work, and those who are higher risk should just stay home. What's the science of that?
Okay. That's a great question. I think people should understand that we are in this pandemic because you basically have a virus that the human population has not encountered before. And this virus has an extreme ability to be transmitted from person to person. And currently in Dutchess and in New York, despite the large numbers we've already encountered, we've been able to bend and flatten the curve somewhat. And all that is not because we have a vaccine, not because we have treatment, but we put in place social distancing and measures to isolate individuals who are currently with the virus. So if we relax those measures without having an appropriate treatment or effective treatment or a vaccine, what you're going to see is that this virus is going to take off and continue transmission cycles, and more people will get sick.
Thank you for that, and I think that obviously is the concern. This doesn't mean that every step we take today and the restrictions we have will sort of conquer this virus forever, but it will buy us the time and save the lives necessary to obviously hopefully get the medical treatment and make sure we have the medical care necessary to deal with those who have contracted the disease. And that's really why we're asking for patience. And believe me, I know, again, I go online, I read what folks have to say. I know the concern about government overreach and the impacts on our daily lives. This is really a war. When this country goes to war, we band together and we make some very difficult decisions. There were curfews and there were limitations put in place during World War II. Some we look back on and say they were extreme. In the aftermath to 9/11, you know that we took actions to restrict travel and access to government documents, and those are steps that we took in response. Some of them you could look back and say maybe we're oversteps. We are in the midst of a real battle, and that battle is about trying to save lives against an enemy that we don't necessarily understand or can't see. And so we need people to be patient. We need us to work together, and we need to make sure that we continue to hunker down, because I know that by doing that we're going to save lives. John was on the phone. We won't go to John. I'll just mention that John was on the line. He offered thank you, your sympathies, I appreciate, but also about where to donate blood. And I actually don't have that answer, but I think it's a great thing. There are certainly blood banks that need help. Dr. V, do you have any direction on that? If not, we'll get you some more information. I don't. How do folks give blood in the current environment?
The hospitals and the Red Cross are a good place to start. They have blood banks they are connected to, and they will provide that information.
Okay, so you can visit the Red Cross, the New York Blood Center online, and the hospitals online. Get that information, and I appreciate that. And if you have the means to assist, visit DuchessNY.gov. Visit the Duchess Responds page. We're happy to accept your help as a volunteer. We need 2 groups of volunteers. We need Medical Reserve Corps volunteers. If you have a medical background, sign up to the Medical Reserve Corps. We have hundreds of people we're helping out. Very grateful to them. If you have no medical background, you still want to volunteer, sign up. Carolyn Morris and Lee Wager from the Dutchess County Legislature have been tasked with organizing those volunteers, working with our planning department and the staff there to make sure that we connect volunteers with people who need help. We're going to go through a series of we'll try to do as quickly as we can. We have about 10 more minutes. A question regarding, is the DMV open? The DMV is not open. The DMV is not open. I think you can do certain things by appointment, correct? So if you call, not records, certain court records. Yeah, so not DMV, but county clerk records, you can do that by calling first. We ask you to do that. But the DMV is not open. If you have a delay, they're not issuing penalties for delayed registrations and what have you. But visit duchessny.gov, and the contact information for the clerk's office and the DMV is at duchessny.gov. But they're not open. Is there a plan to return to normal hours for grocery stores? First of all, a grocery store is not mandated to stay open 24 hours a day, 7 days a week. So they can take steps to restock. I would say to the community, we need to give some of these folks a break. I would not be opposed to a grocery store day off. But that said, the specific businesses need to make those decisions themselves. Very important question from Nancy. Will the Hudson Valley Renegades play this summer? I say only half kiddingly that's very important. Obviously we want to return to some sense of normalcy. The Major League Baseball has been talking about some options, in fact, for Major League Baseball. The catch, of course, is minor league baseball needs people in the stands. And thankfully, our season doesn't start till June. I would expect that if it starts, it'll be delayed. But that's not news. I don't know that for certain. But the opening of minor league baseball will correspond with the other restrictions that we have being lifted. And keeping in mind, I'm with you. I want nothing more than take my kids to the Dutch Stadium to enjoy the Hudson Valley Renegades. But as of this moment, we just need folks to hunker down, stay home, and as the restrictions are lifted, opportunities like that will open up, and I'm so hopeful that we get to see some Renegades baseball. It's one of my favorite things to do during the summer. I want to mention to you we have a lot of folks, as I said, in county government working very, very hard. They have been. Our public health officials have been working for nearly 60 days, and when I say 60 days, they're working 24 hours a day, 7 days a week. As Dr. V mentioned, whether it's tracking cases and updating the data that you see online, or it's contacting and communicating with nursing homes. We have individual teams of people who are communicating directly with assisted living facilities and nursing homes. It could very well be the teams of folks that are connecting the dots between cases. And of course, many other aspects of county government still function. Interestingly, in New York and across the country, county governments are the level of government that provides that public health response. And so we're doing the best we can to respond to your needs. There's a group of people who work every day, all day, no matter the issue, and that is our 911 dispatchers, our public safety telecommunicators. Our dispatchers are working all the time. This is actually a week to recognize them, so I'd ask you to join me in giving them a thumbs up. The 911 dispatchers, they're part of the emergency response infrastructure here. They're doing a great job. In Dutchess, you can call or text 911. Dana Smith, you're still on the line. Those folks work for you at the Department of Emergency Response. Why don't you talk a little bit about the number of calls coming in and how we've been handling 911 calls, just as a way of saying thanks to them?
Yeah, they do a fantastic job, 24 hours a day, 7 days a week, the public safety dispatchers at the Dutchess County 911 Communications Center. Thank you for recognizing them. They've been working tirelessly throughout this event. Prior to widespread community exposure, they've adjusted their questioning to specifically get more information as it relates to COVID and provide that information to the first responders so we can do everything possible to not only protect the first responders but the public as well. Their call volume has been down a little bit over the past month, and a lot of that has to do with the social distancing and the businesses being closed. However, on Monday, they responded and met the needs of the community with the severe storm. and the impact in the 911 call volume as compared to the day before. It had tripled, and they met the needs of the community as they do day in, day out. And it's wonderful that they're recognized, the true first responders. Thank you, sir.
No, I appreciate that very much, and the work they do is tremendously important. I do want to say someone had a question regarding the MTA. You can visit mta.info. That is the website for Metro North schedule. You'll see the altered schedule. You should also note that Dutchess County Transit is still working, although on a limited schedule. We are making a further reduction to the fare. The fares is happening soon. We're actually, in order to accommodate the drivers and make sure we're providing greater protection for those making use of the transit system. You'll see that hopefully tomorrow or the next day. We'll be making further reduction in the fares to limit that interaction and try to provide for everyone's safety, but also make sure we have a transit system that continues to function for those who need to get to essential places of business. You want to try to get Tony's question in? We'll go right to Tony, and then we'll do maybe one or two more on Facebook if we have them. Tony, you had a question regarding testing, and why don't you ask that question? I think it's a good one. It's probably a good way to kind of remind people where we are. Go ahead, Tony.
Okay, I just want to know, are we all going to be tested sooner or later? I mean, is it only going to be people that are sick?
Good question. Hey, Dr. V, why don't you remind folks, I know we answered this a little bit, but what's one, we talked about the timeline. When would there be sort of mass access to testing? And was there any point to testing people, whether or not they've contracted the virus?
I think at this point, the ability to test, we're going to leave in the hands of providers to decide whether to test or not. There is sufficient transmission in the community to warrant giving providers the ability to test whoever they suspect, whether they're symptomatic or not. What it is all dependent on is the capacity of the system with regard to test kits and the labs to actually run those tests on a timely basis. So I think we're slowly moving to the point where access to testing would not be an issue.
Okay, so really it's more about whether or not the kits and the resources are available, and when they are, providers would make those decisions as they do with influenza. Just offer a test, that sort of thing, and that obviously would be the most effective in at least gauging who's contracted. But as you mentioned, we're 18 months to 24 months away from perhaps identifying an actual vaccine or some sort of medical treatment to the disease. And I think that access to testing then becomes more and more valuable as we await that. So I appreciate you being on the call. We've kept you for 90 minutes. I want to go over just some last information. Any other questions or comments on Facebook that might need to address? As we do, I want to remind you that we're going to be live again next Wednesday, April the 22nd. We'll confirm that time. And then again, live telephone and Facebook on Wednesday, April 29th at 5:30 p.m. And we will be every other Wednesday at 5:30 p.m. for the foreseeable future with a Facebook Live and telephone town hall answering your questions. The questions may start to shift as we hopefully return to a new normal, not the old normal, but a new normal. So we'll be with you. Not only do we have that responsibility to serve you, but we'll be with you having these conversations every other Wednesday for the foreseeable future. Every Wednesday we'll be on Facebook Live, but every other Wednesday, telephone and Facebook, 5:30 p.m. will be available to you to answer questions. I want to remind you that if you have additional questions, visit our help hotline at 845-486-3555. You can visit duchessny.gov. We spent tonight talking a lot about the things we can't do, and I know a lot of folks are frustrated by that, frightened by that, anxious about that, and then of course we want to be considerate of others. But there are a lot of things we can do, and I know none of them may necessarily replace the job and the income, and some aren't entirely going to replace the stress. But I can tell you that there are still things we can do. We can spend time with our family and engage in that interaction that too often we miss. I can tell you that our kids need us to do that. They need us to be there, if not to explain what's going on, just to be present with them. So we can still do that. We can still communicate via social media or Facebook or FaceTime or some digital presence, so you can still see your family and still communicate in that way. You can still get out on the bike and go for a ride. You can still go for a hike, but make sure you're socially distant. You can still go for a drive and enjoy that time with your family. I can tell you my 16-year-old daughter, I can't believe I have a 16-year-old daughter. We had a group of family and friends parade past the house, and I can tell you, none of them got out of the car. They all had to keep their distance, but my daughter got to see her friends. I should say thank you to Leo. Abigail is very happy to see you in your suit, and all of her friends who drove by. I'm just saying that these are the things we can do. I'll be as corny as to say we can enjoy the sunrise. We can sit on the front porch, drinking a cup of coffee, taking in that sunset. We could read a book. There are thousands of things we can do. Use them to pass this time. Use it to minimize the stress. Use it to be present with the people we love. And I promise you, if we stay safe, if we stay home, we'll stay healthy. And I encourage us all to be kind to each other. We'll see you again next week. Thanks for participating with us this evening. And please reach out if you have any additional questions. Have a good night.